In this video, we will discuss the principles for applying skin traction. First, we will cover the indications for traction. So, we may do traction to reduce a fracture and realign bone ends. We can also do traction to maintain skeletal length and alignment, or to do immobilization of the limb to prevent further tissue damage. Now we'll discuss how to apply the non-adhesive skin traction. We will have to prepare the proper materials. We'll need to have skin traction, elastic bandages, which usually come with the skin traction, and a pair of gloves. It's always handy to have more elastic bandages and cotton padding just in case. To apply the skin traction, an assistant slightly raises the leg and applies mild traction. Now place the stirrup of the skin traction just 5 centimeters below the sole of the foot and put the ends of the skin traction, one medially over the medial malleolus and one laterally over the lateral malleolus until it reaches the knee. Roll elastic bandages over the ends of the skin traction from the ankle until the knee above. Make sure each roll overlaps 50% of the previous roll of bandage. It is possible to add padding beneath the elastic bandage as well. Make sure no wrinkles occur while rolling the elastic bandage. We want the traction to look like the image on the left once we finish in the end. After finishing, make sure the patient can wiggle their toes freely and there is no excessive pain or tightness. We can raise the angulation of the bed. This can increase traction if the degree of traction is not sufficient. Now we tie a weight of around average 4.5 kilograms to the stirrup. We must make sure that the weight does not touch the ground, or else there won't be any traction. There are some important points that we need to take care of after we apply skin traction. 1. We must ensure the patient's leg does not rest on the end of the bed. 2. We must prevent the traction weight from touching the floor. 3. We can increase the weight if the traction is insufficient. 4. The patient must report any new onset of pain immediately. 5. Ensure the foot remains in a neutral position, with toes pointing upward rather than deviating to the left or right.